Emphysema. It is an respiratory disease. Look at this picture, shows that alveoli destruction and chest X-ray findings, CT findings, and MRI detail going on. Introduction. Emphysema is a chronic lung condition that is part of group of disease known as chronic obstructive pulmonary disease COPD. It primarily involves the destruction of the alveoli, the thin air sacs in the lungs, responsible for gas exchanges. This leads to reduced oxygen transfer to the bloodstream, causing breathing difficulties and other respiratory issues. A definition. Emphysema is a chronic lung disease characterized by the destruction of alveoli, leading to breathing difficulties and reduced oxygen exchange. The primary cause is long-term smoking, and the condition is managed through lifestyle changes, medications, and sometimes surgical interventions. Types. Centrilobular emphysema primarily affects the upper lobes of the lungs and is commonly associated with long-term cigarette smoking. Second, panlobular emphysema involves the entire lungs, including both the central and peripheral parts. Is often linked to alpha-1 antitrypsin deficiency. 3. Paraseptal emphysema affects the peripheral parts of the lobes and can cause spontaneous pneumothorax in young adults. Causes. 1. Smoking. The leading cause of emphysema, responsible for the majority of cause. Second, alpha-1 antitrypsin deficiency, a genetic condition that can lead to early onset emphysema. 3. Air pollution. Long-term exposure to air pollution can contribute to the development of emphysema. 4. Occupational exposure. Inhalation of dust, chemical fumes, and other irritants at the workplace. Risk factors. 1. Age. Most people with emphysema are at least 40 years old when symptoms begin. Second, genetics. family history of emphysema or COPD increase risk. 3. Exposure to second-handed smoke increases the likelihood of developing emphysema. 4. Respiratory infections. Frequent lung infection can damage lung tissue. Complications. 1. Respiratory infections. Increased susceptibility to infections like pneumonia. 2. Collapsed lungs. Emphysema can cause the lungs to collapse. Pneumothorax. 3. Heart problems. Increased pressure in the arteries that connect the heart and lungs can cause a condition called cor pulmonale and large holes in the lungs. Bullae can form in the lungs, leading to reduced lung function and the risk of collapsed lung. Pathophysiology. Emphysema results from the breakdown of elastin, a protein in the lungs connective tissue. The destruction of alveoli reduces the surface area available for gas exchange, leading to decreased oxygen of the blood. Additionally, the loss of elastic recoil in the lungs makes it difficult to expel air, causing air trapping and hyperinflation of the lungs. Signs and symptoms. 1. Shortness of breath, especially during physical activities. 2. Chronic cough, often accompanied by mucus production. 3. Wheezing, a whistling sound while breathing. 4. Chest tightness, feeling of constriction in the chest. 5. Fatigue, reduced ability to perform daily activities. Diagnosis. 1. Pulmonary function test PFTs measure lung function and airflow obstruction. 2. Chest X-ray shows hyperinflation of the lungs and flattened diaphragm. 3. CT scan provides detailed images of the lungs to identify emphysema. 4. Arterial blood gas analysis measures oxygen and carbon dioxide levels in the blood. 5. Alpha 1 antitrypsin test checks for genetic deficiency. Nursing diagnosis. 1. Impaired gas exchange related to destruction of alveoli. 2. Ineffective breathing pattern due to decreased lung elasticity and air trapping. 3. Activity intolerance related to dysphagia and decrease oxygenation. 4. Risk for infection due to impaired lungs function and increase mucus production. Management and treatment. On smoking cessation, the most critical step in managing emphysema. Second, medications, bronchodilators, corticosteroids, and antibiotics for infections. 3. Oxygen therapy helps improve oxygen levels in the blood. 4. Pulmonary rehabilitation, exercise training, and education to improve quality of life. 5. Surgery, lung volume reduction surgery or lung transplantation in severe cases. Psychosocial medicine. 1. Support groups provide emotional support and coping strategies. 2. Mental health counseling helps manage anxiety, depression associated with chronic illness. 3. Patient education, teaching about disease management and healthy lifestyle choices. Prevention. 1. Avoid smoking is primary prevention method. 2. Reduce exposure to lung irritants, limits exposure to air pollution, chemical fumes, and dust. 3. Vaccination, annual flu shots and pneumococcal vaccines to prevent respiratory infections. 3. Regular checkups, early detection and management of respiratory issues. In conclusion, emphysema is a serious progressive lung disease that significantly impacts a person's quality of life. Early diagnosis and intervention, lifestyle modifications, and appropriate medical management are crucial in solving disease progression and improving patient outcomes. Comprehensive care, including psychosocial support, is essential for managing the multi-factor challenges of living with emphysema. Thank you. Have a wonderful day.